Hello, my name is Leonard Friedman, and I would like to welcome all of you to Module 8, Systems Thinking and Learning in Healthcare. This is the capstone course for the Executive MHA program, the MHA at GWU.
My name's Andrew Wiss, and I'm the Director of Online Learning at the Milken Institute School of Public Health. I'm also a lecturer within the Department of Health Policy and Management, and one of the co-architects of this course, Module 8, Systems Thinking and Learning.
My name is Donald Lewis. I was born and raised in Baltimore, Maryland, and I have worked in healthcare for 30 plus years. I was a hospital CEO for 25 of those years. I've also worked in long-term care. I worked at a hospital association. I've done a lot of advocacy and representation work in my career. I'm married. My wife and I have 4 children and 3 grandchildren, and they live up and down the East Coast. I am a graduate of the George Washington University. I have a master's degree in healthcare and hospital administration. I am a fellow of the American College of Healthcare Executives, and I am board certified in healthcare management.
I'm hoping to bring some of the consulting experience that I've had across a variety of disciplines and domains, some in healthcare and public health, others in automotive, some in finance, some in consumer electronics. But I'm hoping to bring all of these different solutions and experience to you to help you as managers and leaders think about how to develop effective learning solutions at 3 different levels within your organization. First, focused on individuals, what it is that makes adult learners tick, and how do we motivate them and help them learn and achieve and become better and more expert within our organizations. Then I hope to help you think a little bit more about learning at the community and team level, what it is that helps people share knowledge and collaborate with one another, and how we put structures and systems in place within organizations to support formal and informal learning. And then finally, at the organizational level, I want to talk to you a little bit about courage and what it takes to lead organizations and to stimulate learning within organizations.
I have a great deal of admiration and respect for everybody that works in healthcare. It is a calling. It is not a profession per se. We make a profession out of it, but it's definitely a calling. When you look at this course, you think about why it is that the systems thinking and learning course is the capstone course for this master's program. Let me just give you a couple of my thoughts about that. One is that systems thinking and learning is absolutely essential in today's world. In order to shepherd the healthcare system of the future, healthcare system of today into the future, we really need to begin to look at things from a different perspective. We need to understand how what we do and how we think and how we relate to people in the organization and to the organization and its relationships to others outside the organization, what impact that has on the development and the prosperity of that organization from the perspective of providing services to the people that we're there to serve. So that's one of the aspects of systems that makes this really, really important. Healthcare and healthcare leaders work in a very stressful, very dynamic environment. They absolutely need to be able to begin to look at things in such a way and have the synergy of an organization behind them in order to do the things that have to be done. No one understands more than I do personally what it's like to be the CEO of a hospital, because I did it for a lot of years. It is very demanding, and being a leader in a healthcare organization takes a lot of intelligence, intuitiveness, the desire to work for the greater good, and an ability to bring things together. And systems thinking and systems design supports the evolution of that happening.
In looking at executive education across the country, this is an area that is rarely, if ever, seen. Yet on the basis of conversations that we have had with healthcare leaders, one of the things that we have found out is that healthcare organizations that are successful and that will continue to be successful going forward are those who take a systems perspective. And it's important to have all of the content from all of the various modules that you've obtained. But we think what is going to make a truly significant difference is the material, the content, the different way of thinking that will come about as a result of this particular module. So welcome to Module 8, welcome to this class, and we look forward to being with you for the next 10 weeks.